All right, so now we are going to welcome to the stage Ashley Fueston, the Vice President of WFSE.
Thank you. Hi, friends. I represent over 48,000 members of Washington Federation of State Employees. In our union of state employees, we understand the power of solidarity. We know that when we stand together, shoulder to shoulder, there's nothing we can't achieve. And today, we stand united in our call for universal health care, a call that echoes the voices of millions who struggle to access equitable and affordable health care. We've all heard the stories. Stories about people forced into bankruptcy due to medical bills, stories of individuals rationing their medication, stories of loved ones suffering needlessly because they couldn't see a doctor in time, stories of choosing between necessary medical care and paying the rent. These stories are not just statistics. These are the harsh realities faced by our neighbors, our friends, and our fellow citizens. It is an injustice that in a country as wealthy as ours, access to healthcare is treated as a privilege rather than a right. It is an injustice that profit margins often dictate who receives care and who is left to suffer. But today, we say enough is enough. Today, we declare that healthcare is not a commodity to be bought and sold. It is a fundamental human right that must be guaranteed to all, regardless of wealth or status. Our fight for universal healthcare is not just about policies and legislation. It's about values, values of compassion, empathy, and solidarity. It's about recognizing that when one of us suffers, we all suffer. When one of us thrives, we all thrive. It's about standing together as a community to ensure that every person has the opportunity to live a healthy and dignified life. Too often we see employers use healthcare as a bargaining chip against better working conditions or as an excuse as to why they can't afford to pay workers a living wage. And let's be real, we can't talk about healthcare without addressing the social determinants of health. Factors like employment that pays a living wage, affordable housing, mental health supports, equal education, economic stability, food security, and a healthy, clean environment. These are the underlying factors that significantly impact one's well-being. We must acknowledge and address these interconnected issues if we are truly to achieve universal health care. So, fellow humans, let us channel our frustration into action. Let us raise our voices, write to our representatives, and most importantly, mobilize our communities to demand change. Let us make it clear to those in power, we will not rest until every person from this Washington to the other has access to quality and affordable health care. Let us remember that the fight for universal health care is not easy, but it is just. It is a fight worth fighting, and together, in solidarity, we will prevail. So thank you for your unwavering commitment to this cause, and let us continue to stand together until universal health care becomes a reality for all.